Hi you guys, Ashley Chandler from Advanced Physical Therapy Solutions here in Fayetteville, North Carolina. Here to talk to you about oncology and PT, something that a lot of people don't think necessarily have much of a tie to each other. I certainly don't think I learned much about it back in PT school several years back. So if you want to know more about how I ended up in this field, check back to a video about a week ago that I posted. It's an integral relationship between PT and oncology. So I really believe that if PT is involved from the start of somebody's cancer journey, we can help with a lot of the side effects that come up, because there's a good number of side effects and opportunities for loss of function during your oncology or cancer treatment journey. So what we in the oncology and PT world dream of is that when you sit down to the scariest perhaps moments of your life and hear the doctors say it's cancer, that's kind of when you fuzz out and you don't hear much else. But that after you kind of come back and you have all of your appointments planned out, that PT is one of them. That we can be involved in that very beginning parts of your journey. That allows us to be able to see who you are and what your baseline function is. So what can you do? What kind of job do you do? What kind of family activities do you participate in? What kind of hobbies? All those things that make you you from a movement perspective, we can see what that is. We can see any premorbid things you've got going on, old shoulder injury, back injury, whatever it may be. We can take a peek at it and see if that's going to be something that may be involved in your plan of care. If you're going to end up having some sort of a surgery that removes lymph nodes, if it's appropriate, we can give you some education about what to watch for, signs and symptoms, what the latest research has to tell us about lymphedema and risk factors. And then my favorite thing is to be able to follow somebody through their journey with cancer, to be able to be there for our 1 hour, most weeks. Usually I end up seeing people weekly at least, and I get a full hour with them, and we get to kind of work through movement, and we always end up talking about the psychological component of the hardships and the changes, and a lot of times we can find ways to get them perhaps it's a new normal, but some semblance of their old activities modified to be appropriate during their surgery, recovery, chemo, radiation, whatever it may be. We have this beautiful place in the medical field where we can spend time with our patients. We can talk to them. We can involve family members. I just had one of my ladies bring in her husband who wanted to be able to help with some soft tissue work after some of her surgeries and wasn't sure how to do it. So he came in and we worked through hand placements and depth of pressure and all sorts of details about how he could help support his wife through her journey with cancer, because he's on that journey as well. So we like to follow people from beginning to end, and oftentimes even after medical oncology treatment is over, there's still a place for PT, which is oftentimes where kind of old school thoughts, I feel like we thought, okay, it's appropriate for somebody to have shoulder dysfunction down the road after breast cancer. So they have a mastectomy, they have radiation on top of that, they have this gnarly tissue on the front of their chest wall pulling that shoulder joint forward. And I saw several of those women 5, 10 years, 15 years after the fact, and they never had PT. They thought I was crazy when I asked that. But why can't we do it right at the time? My cat is biting my head, you guys. Why can't we help them at that time? And hopefully they don't need a PT in 5, 10, 15 years, because we've already addressed it. They're back to moving well. So food for thought. Think about PT and oncology. I rambled a bit, but it's my thing. I love it. Remember that if anything happens, or you have a loved one or a friend or a family member or whoever it may be who has that awful meeting with the physician that tells you those dreaded words, that, hey, did they talk about PT? Maybe that could help for you. And it's worth it. Most people, we end up finding a couple things that we could get better. I have had a few people that come in for their initial check, and I'm like, you look good. And give them a ton of education for the hour that I'm with them. Watch for this, do this. This is what the research is saying about exercise, about fitness, about sleep quality, emotions, those sorts of things. And then call me if you need me. But a lot of people there is a bit more that we can also help with. So spread the word. Us PTs aren't really good at self-promoting, and I hate to do it, but PT can be great. It can help a lot, and we can educate you and send you out knowing more about your body and what it's gone through during your oncology journey. So call up any PT, a local PT, call me up at Advanced Physical Therapy Solutions and see if you can get in, and we can see if we can make your movement better.